policymakers, of our government, has been a stress on Make in India. It's going to be the key factor in getting a healthcare equity, certainly getting more and more advanced techniques and technologies, and for that matter, even the routine techniques and technologies, down to tier 2 cities, tier 3 cities, and down to the grassroots level. I think that's an initiative that we're going to take forward. And I would say not just Make in India, but also research and science and advancements through India for the Indians. I think it's time to consolidate the lessons from the COVID pandemic and how we fought the COVID pandemic to what's going to happen to healthcare for the future. There are 3 lessons which came forth and were tremendous initiatives again of our policymakers and the government. Of course, there's the telemedicine and telecommunication all the way downstream, which helped numerous people, numerous doctors, numerous patients during the lockdowns. There is the important aspect we must not forget. The whole country fought this pandemic together. So strong partnership, trust and understanding built up between the policymakers, the government, the private sector, the private healthcare, the paramedical, the healthcare workers, the manufacturers, the device manufacturers, including the patient base itself. All the stakeholders got involved, and we must not forget that aspect of trust and partnership and build up on that partnership. So if I was to put this into 2 buckets and say what's going to be the future, on what we can actually augment for the future, it's this issue around technology and telecommunication to create a healthcare equity downstream to the common man into the villages. And that can be done through many forces, including improvement upstream and downstream. And then, of course, the partnership, greater partnership between the stakeholders sitting around the table and achieving an India of tomorrow and achieving a healthcare delivery patterns for tomorrow. A great opportunity to cement on the learnings from COVID, where every stakeholder fought it together for one aim, and that was to get rid of the virus and make everyone better. If you look at the last 3 years, the fight against COVID and the recovery thereof, the most important thing which comes to notice is the fact that we fought it all together. The nation came together. The policymakers, the government initiatives saved us from a havoc which could have been. We look at indigenous research and science, the partnership between the private and the government sector, which produced vaccines, the partnership between the industry and the government, which produced numerous PPEs and masks. N95s, which were not available earlier, became a thing of the present. If you look at patient care, objectives around keeping everybody healthy, keeping everybody safe, a true partnership. So I think as we move into the future, and by the way, most importantly, every person in this country got the same treatment, irrespective of where he lived and irrespective of his economic status. Every person in this country was cared for. A true healthcare equity happened during COVID times. And therefore, if I look at this together, and if we can get the stakeholders to continue to think together and to continue to work together, every government initiative I know is now aimed at getting everybody around the table, creating this partnership with a single motto. And the motto, I think, is achieving healthcare equity for this country together. And that should be our motto. Simple decrease in charges and costs is not the real issue. The real issue is, can we get quality care down to every person in this country, irrespective of economic status and irrespective of where he lives, even in the remotest villages. So it's true healthcare equity for all and together.